right.
Right.
Here we go. I'm so excited for this webinar. I am going to go ahead and thank everybody for joining us tonight. We really appreciate you taking that time. And Jackie, I appreciate you taking this time. I always learn so much from you, so I'm really looking forward to this. Jackie Wilkinson is a registered dietitian here at Upland Hills Health and is also our certified diabetes educator. So I'm going to let you talk a little bit about what your role is, what you do here at Upland Hills Health, and we'll go from there.
Sure. So I am a registered dietitian and diabetes educator, and really, I feel like what I do is I kind of educate, but also help coach people and really help them manage their blood sugars a little bit better, kind of navigate the maze, because there's so much that goes into blood sugar management.
Okay, awesome. So can you explain a little bit about what diabetes is? When I get a diabetes diagnosis, I think we all know there's type 1 and type 2, but what does that mean? What is diabetes?
Sure, yeah. So, I mean, really in most simplistic terms, diabetes is elevated blood sugar. So it's just a condition in which blood sugars are elevated and are kind of staying elevated. And there are a couple of different types of diabetes. So there's type 1 and type 2 diabetes. And I often get people who will say, well, I was type 2, but now I'm type 1, that kind of a thing, which isn't quite the case. So they're very different animals in terms of the diagnoses and what they are. So type 1 diabetes, if we think about that, that's actually an autoimmune condition, meaning that's going to be, think about like Crohn's disease or ulcerative colitis or celiac disease. All of those conditions are autoimmune conditions. And what that is it's your body's immune system kind of attacks and destroys the pancreas, which is that organ that produces insulin. And so those folks, their bodies don't produce any insulin. And for those people, then they have to take insulin kind of for the rest of their lives. Their body will never produce it. And if we kind of take a step back and think about what that means, so I like to just explain what insulin does in the body, because that is key to everything in terms of diabetes in general. So when we think about eating food, okay, so we're eating food, and when we eat food that has carbohydrates, those carbohydrates are going to break down into sugar, okay, so our gut kind of breaks that food down into sugar. Sugar gets absorbed into our bloodstream and it makes blood sugars rise. Now, ultimately, we want to get that sugar from our bloodstream into our body cells to use for energy, okay? So as our blood sugar is rising and we're absorbing those carbohydrates that were broken down into sugar, that sends a signal to our pancreas, and that is the organ that secretes insulin. And that signal is saying like, hey, blood sugar is rising, we need a little bit of insulin. And insulin is secreted, and I think about insulin as kind of this key, okay? So it unlocks the door to the cell, so our body cell's door can open, and the sugar can get from the bloodstream into the cell. But we need that key, right? So for those people with type 1 diabetes, they just don't have it. And that's why it is critical that they take insulin, because they can't have that sugar hang out in their bloodstream forever. So for type 2 diabetes, it is a very different animal. So type 2 diabetes is much more genetic in nature, meaning if you have people in your family with type 2 diabetes, you're much more just predisposed to getting that condition. But there's two things that are happening in type 2 diabetes. And I want to just mention that your body is still producing insulin. So our pancreas is still working. It's still going, so we're still producing insulin. But the first thing that kind of starts happening is we're eating that food, we're breaking it down into sugar. Sugar is absorbed into the bloodstream. We're sending the signal to the pancreas, but the pancreas is secreting insulin. It's like throwing that insulin out, but for some reason, we decided to change the locks on the door, and it doesn't fit in to open that cell door. And I don't want to say every single cell door. So most cell doors are still opening, but there's some, and more are happening that lock isn't working. So we're getting, and that's what's called insulin resistance. So we're producing this insulin, but it's resistant. It's not getting into that lock. So our pancreas is having to work harder and harder and harder because it keeps getting that signal that our blood sugar is high. And so it's like, what's going on here? And throwing insulin out, what's happening? And it's just not getting into that key. And that's when our pancreas is like, I need a break. I'm going to go on vacation. I'm going to go to Aruba. I'm going to sit on the beach. I can't do it. Like, when are we ever going to go on vacation again? Right. And that's when folks with type 2 diabetes might start needing to take insulin because their pancreas is just worn out. It needs a break.
Okay. So what I'm hearing is type 2 diabetes kind of starts over here and it progresses unless it gets controlled in between.
Yes, it is a progressive condition. And I want to say, though, that even with managing blood sugars, that progression can still kind of happen.
Okay. Okay, that's good to know. So having that elevated blood sugar, there's more sugar in the blood. What does that do? How is that important? What's happening with that?
Yeah. Why should I care, right?
Right.
We can still go around. Yeah. And I think that's one of the biggest questions I get asked is like, okay, so I have diabetes and my blood sugars are elevated, but what's the point? Like, why should I really care about this? And it's interesting, if you think about elevated blood sugars, it's really, thinking about that extra sugar in your bloodstream. Think about it's like really thick and viscous and sticky, a lot like a syrup or a honey, or, those really thick and sugary kind of condiments that we use. It's very sticky, so the body trying to push that really thick, syrupy blood through our bloodstream puts a ton of strain on the body. I mean, that's why the heart can be affected, right? Because our heart is having to work way hard to push a lot of that blood through. But then also thinking about the smallest of the small blood vessels, like in our eyes, in our extremities, in our kidneys, in our brain, that puts a lot of strain on those tiny, tiny vessels because it's so difficult to get that really thick, viscous, sticky blood through those tiny openings.
Okay, that makes sense. We have a question. Is that why blindness is a concern?
Yeah, absolutely. I mean, any organ that that touches the blood, which is literally every single organ, can be affected by those elevated blood sugars. And thinking about how tiny those vessels are in our eyes, I mean, those could be kind of the first things that can be affected.
Wow. Okay. So when should I be concerned that I might be diabetic? What are some of the symptoms that should be a red flag for me to go to the doctor and know that I'm diabetic?
Yeah, that's a great question because we always kind of want to be aware and kind of catch this as soon as we can. But I will say a lot of people, they really don't have any symptoms. So many people will come in and say, I felt fine. I still feel fine. I had no idea I was walking around with high blood sugars. But common symptoms would be feeling very thirsty, feeling kind of fatigued or just foggy, not quite with it, like you're looking through a fog, you're just feeling tired a lot, peeing a lot, so urinating a lot, feeling hungry. So more kind of worse conditions could be like if you are losing weight, but you're eating a lot, that can be a sign of very elevated blood sugars.
Okay. Yeah. So what do you talk to people about? How do we keep blood sugars under control to try to slow that progression down?
Yes, that's a great question. I think, it's difficult because there are so many things that can affect blood sugars. And for a lot of people, so many things that are outside of their control that can affect blood sugars. And it makes it really, really difficult to think about all of these things. But I really like to tell people there are three things that we can control to help manage our blood sugars. The first being, what we're eating on a day-to-day basis, so our nutrition. The second being our physical activity, so movement, and if we're getting any. And the third is just medication. So if we're prescribed medication, are we taking it as prescribed?
Okay, that makes sense. So talk a little bit more about nutrition. I think that there still exists this fear of this carb counting and this being a really big animal and having to completely change what I'm eating, and I can't have treats and things like So talk to me a little bit more about that. I know I've learned from you that that's not really how things go now.
Yeah. And I think that's the biggest fear for most people is they're like, oh my gosh, she's going to tell me that I can't eat this and I'm never going to be able to go out again. And I have to and people are going to be watching what I eat. And that's not, in essence, the case. So, I mean, previously, yes, this was sort of the concept that we were going to teach everybody how to carb count. And if you think back to when we were talking about how blood sugars rise and the food that we're eating, it's really those foods that contain carbohydrates that affect blood sugars the most, meaning make them rise the highest. And so by counting how many grams of carbohydrates we eat, we can keep it lower and blood sugars might not rise as high. But what most of us realized is that it's not realistic for every single person to be able to do that. And number two, I mean, who wants to do that? I know I would be a huge hypocrite because it's not something I would be able to do every day, And so really it's more about watching, how much carbohydrate we're eating at one time and just watching portion sizes of those foods that have carbohydrates. And it could be as simple as decreasing, the amount of, like, let's say we have a baked potato every night for supper.
Okay.
And, what we're going to do is we're going to say, okay, instead of a whole baked potato, I'm just going to have a half a baked potato every night. And that's just decreasing the amount of carbohydrates that we're having at that meal, but over time can make a huge difference in terms of how blood sugars are being managed.
Okay. So we have a question,
Yes.
and it's a good one. If I've heard that if I have a diabetic person that I know who's acting a little off kilter, I should give them sugar, like orange juice. That seems kind of backwards.
Yeah. Well, and I think so if you have somebody with diabetes that and they're acting a little off, I think the first thing to do is to check a blood sugar on them just to see if it's blood sugar related, because that many things can cause them acting off maybe a little bit. And if it is blood sugar related, meaning blood sugars might be too low. So we think about anything under 70 being a low blood sugar.
Okay.
Then it is important to treat with some simple sugar that will bring blood sugars up very quickly. So simple sugar being like some orange juice or any kind of juice, honestly, regular soda, even just a little bit of sugar or honey under the tongue can get absorbed very quickly. And that goes into our bloodstream and raises blood sugars very fast.
Okay. Awesome. So back to the 3 things that we can control. You talked about movement or exercise.
Yeah.
Are we talking daunting exercise routine here, or are we also talking little things like we were with nutrition?
Yeah. And I think that's also, it's important to talk about exercise because, I'm a dietitian, so I can talk about nutrition all the time, but exercise is so important as well. And I often think exercise for a lot of people is like this nasty word. So sometimes I call physical activity, I just say physical activity because it's supposed to sound a little bit better. I don't know. But any kind of muscle movement, whether it's, walking around your living room, after a meal, or walking up and down the stairs in your house, once a day, any kind of muscle movement that engages your muscles and makes them work, even the smallest amount, can help those muscle cells pull sugar out of your bloodstream to use for energy. And so that's why, even if it's a 5-minute little step, walk around your living room daily, going from starting there, that will make a big difference, going forward.
Okay. Excellent. And the third thing was medication, to take the medication that we're prescribed. As prescribed, you said, correct?
As prescribed, yes.
So does everyone get medication? I feel like it's common that we get a prescription for, say, metformin. That seems like a popular one that I'm aware of. Or is it manageable? Is the condition manageable just through diet and exercise?
I think, that's it can be a complicated question because I often think that every single person with type 2 diabetes has their own condition. Like nobody looks exactly the same. And it's because of that genetic component. So there are a lot of people that definitely can manage their blood sugars just with lifestyle through nutrition and physical activity. But there are many people who just need a little bit of help. And that might not be anything that's their fault, but it could just be that genetic component coming in. And so there are a lot of people that do have medication as well, with those lifestyle factors.
Okay. All right. That makes sense. I really, really want to talk about something that you've already taught me. And that is, I might be projecting my own fear onto people, but I think one of the worst parts about managing diabetes is pricking your fingers and taking your blood sugar. That might just be me. But I would love it if you would talk about some of the new technology that's around for managing, or I guess recording, blood sugars.
Yeah, taking in data is what we call, right? Like collecting data on blood sugars. And it's interesting. So back in the day, like 30, 40 years ago, in blood sugar, the way we checked blood sugars is we had people, when they went to the bathroom, when they peed or urinated, then they would have this little stick and they would stick it in their urine, and whatever color it came up as was like a range of what that blood sugar would be. So talk about not very accurate.
Right.
But now we're here with those glucometers, those blood sugar meters, where you prick your finger and you get the blood out and you put it on the strip and it tells you what your blood sugar is. The newer technology that's now coming out are called continuous glucose monitors. And what those are is they're almost like little patches. And there's a few different types. I mean, not as many as the number of glucometers out there. But you either place that patch on the back of your upper arm or your abdomen. There are other places you can put it, but those are the most common. And it has this little needle or filament that just goes right underneath the skin of that area. And that is consistently or constantly checking the sugar in the fluid just underneath your skin every 1 or 5 minutes continuously.
Wow.
Most of the time, those sensors last for about 2 weeks, anywhere from 10 days to 2 weeks. So you place them and then you don't have to think about them until, those 2 weeks are up and you take them off. And that sensor is constantly sending data to what we call kind of like a reader. It looks a lot like what a typical glucometer looks like these days.
Okay.
And it shows you what your number is right on that reader. So you can see in real time how your glucose is trending from day to day, hour to hour, minute to minute.
That sounds so cool. I'm a data nerd, so I think that's great. But tell me a little bit about what we do with that data. I mean, it sounds great to know a lot, but what does it tell? What's the benefit of it?
What's the
besides not
that's great.
Finger all the time.
Right. Well, yeah, that's one great benefit. What I always tell people and what a lot of people will say is, the more information is better. But like you said, Jody, it's horrendous to prick your finger all the time, right? You can't prick it every minute, every 5 minutes like that sensor would. Even checking once a day for a lot of people is very, very difficult. And so, and we'd also kind of give out these generalized recommendations to people like, yes, foods with carbohydrates will raise your blood sugars, but every single person's blood sugar reacts differently to the foods they eat or the exercise that they do. And so by having some of these, the sensor with, the reader, and you get that real-time data for, every minute or every 5 minutes, you can really see, wow, this food really affects my blood sugar in real time and without having to prick that finger, or gosh, this exercise really makes my blood sugars go really low. And so in essence, you can really avoid kind of having a low blood sugar event, or you can avoid having a high blood sugar event.
That sounds really, really valuable.
Yes, it's awesome.
Very
I love
cool.
it.
I'm going to check and see if we have any more questions. We have a question. I think that we are basically asking when we're taking a blood sugar reading below 70 or consistently above 150. Does that make sense to you?
So probably what that person is saying is, so the kind of the baseline blood sugar, if we're checking a blood sugar with a glucometer typically, and we're pricking our finger, in that way, we're checking a blood sugar in the morning before we have something to eat. The goal for blood sugar would be anywhere between 70 to 130 is kind of that goal range.
Okay, all right. And again, that's for data. We collect that kind of from the glucometer standpoint. It sounds more like the data that's collected isn't used to make immediate changes in your eating habits or your exercise, but it's more to collect the data to share with your physician. Is that accurate?
Yeah. I mean, it's difficult because with checking a blood sugar on a glucometer, pricking your finger, you just don't get as much information in real time. So to know, like, gosh, this food really affects my blood sugar, you'd have to be checking your blood sugar on that glucometer every 5 minutes for before you started eating up to 3 hours later, to really understand. And so you can collect data and understand things on that glucometer, and that works for some people. But the continuous glucose monitors, I kind of think of them as shining light in the shadows. It shines light on all of those shadows that you're not getting when you're just checking a blood sugar for that finger prick.
Okay, that makes sense. We have another question that is going to lead me right into how I wanted to sign us off, but I'm going to get to that in just a second. But first, I just want to summarize what we've talked about, and please jump in if I say something that's not quite right. So we're looking at diabetes, and I think we concentrated a little more on type 2 diabetes. That sounds like that's more of the patients that you generally see. So it's basically too much sugar in the blood. And then that winds up making that blood really thick, like a syrup, and that puts more stress on all of our internal organs and on our heart and blood vessels, because our heart has to try to pump then that thick blood, and it makes it difficult to get into the tiny blood vessels, like in our extremities, in our eyes. You mentioned kidneys as well, and that can cause damage to internal organs. If a person thinks they might have diabetes, definitely see your doctor. Some main symptoms would be extreme thirst, urinating more frequently, kind of a crazy brain fog sort of a feeling that doesn't go away and isn't really explained in a different way. There are ways to keep the blood sugar under control, and those are nutrition, our movement, or using our muscles. And I really want to just reiterate, because I love that you taught me this, the muscles, when we use our muscles, they actually draw sugar out of our blood to use for energy. So any movement does that for us. And medication, if you're prescribed medication, be sure you're taking that the way your doctor prescribed it. We check our blood sugar so that we have some data to work with and we can understand what's happening in our bodies. There is new technology that has happened. And is that covered by insurance, Jackie, generally?
Yeah, it's dependent on your insurance coverage, and it's also dependent upon the criteria that insurance company would make that person meet.
Oh, okay.
It's kind of complicated. For most, it's becoming much more widely accepted under most insurance coverage and most insurance companies, but it is something that I can help people navigate as well.
Oh, that is very cool. So that is the continuous glucose monitor, which is a lot less finger pricking and gives a lot more real-time data.
Yes.
I also really want to reiterate, because I love that you said that every person who has diabetes has their own disease. Blood sugars are affected in every individual person differently. So I love that you take that approach as well. So the question leads us to our ending here. The question is, do I need a referral to see Jackie? So tell us, how can people come see you and learn more and get some advice about how to manage their blood sugars?
Yes, great question. So it is referral based, meaning all you need is a referral from your primary care physician. And that will, alert our scheduling department, and we can get you scheduled pretty quickly. Yeah, but it's a very simple thing. You just call your clinic, You can even call me. It's simple for me to just call the clinic as well, but I've never had a physician say, no, I don't want you to see Jackie. I don't want you to be able to take control of your blood sugars. No.
So if we want to see you, it's probably a done deal. That's
Yes.
awesome. So can you see, are you generally just seeing people who are newly diagnosed, or as it sounds like things have changed over the years, can I come see you if I've, been a diabetic for 15 years and I need some new information?
Yeah, absolutely. Yes. So I can see, as long as there's a diagnosis of diabetes, whether it's type 1, type 2, gestational diabetes, at any point, I could see them. Yes.
Okay, that's
Yeah.
great. Excellent. It looks like we don't have any other questions, but I'm getting some thank you messages. And I want to say the same thank you for taking your time, Jackie, to help
Yeah.
educate. I have learned so much from you, and I'm so happy that you are gracious enough to share it with everyone else. I think it's a very important topic.
Thank
And thank
you.
you everyone who participated and spent your time with us tonight as well. This session is recorded, and I will be posting it up on the Upland Hills Health YouTube channel tomorrow. Thanks so much.
Thank you.